Hey, Dr. Alan Christianson here with you. So good to connect. I've gotten a lot of feedback from people over the years who wish they didn't need to take thyroid medication. And there's a lot of valid reasons for that. No one wants to be on a medicine that's not necessary. And there's been a lot of data saying how many who are on medications didn't have to be on them, and that there can be risks, there can be side effects. So a real popular question is, how can you stop if you're already on them? And I want to walk you through what we know about this whole topic and how it all works if someone does embark upon deprescribing. And of course, this is something you want to do with the guidance and the help of your prescriber, but I'll share with you what we know about this. And those who are here with me live, if you have questions about your own situation that I can help with, I'll be glad to do so. So feel free to put those up and I'll be keeping an eye out for those. Okay, so quick overview. Thyroid medications are the most widely used medications in the world right now. And upwards of 85% of those who are taking them, probably now we know they weren't needed for. But yeah, these are among the top 2 or 3 prescribed medications globally. And I'm seeing some of you all come on. Welcome. Good to see you here. And the reasons people are put on medication are because they've got Hashimoto's, because they've got hypothyroidism. Those are the big 2. Now, the Hashimoto side, that means you've got thyroid antibodies, or you've got signs of thyroid autoimmunity. And that's important. That's totally relevant to your health. But the data is really clear that medications don't help with the Hashimoto side of it. They don't improve that part of it. And then hypothyroidism, that exists to different degrees. There's mild or moderate or severe. And we know about these stages based upon the thyroid blood levels. So mild hypothyroidism, that's where thyroid levels are normal, but they're not ideal. They're outside of optimal in some way. Moderate is also called subclinical. That's where TSH levels are up, they're elevated, but T4 has not dropped off. And then finally, severe is also called overt hypothyroidism. That's where the TSH is up and the T4 goes way below range. Now, at that stage, medications are consistently helpful and they're necessary. The other stages, there's good evidence now that medications don't make a big difference. They actually don't help to reduce symptoms and they don't improve longer term health outcomes. And that's where most people start out at, is at these mild to moderate stages. So the thought is, first off, if you are on medications, could you change that and would you want to? I mentioned before that a lot of people just don't want to be on meds in general, and that makes sense. But there's more evidence now that not only do they just not work that well, but they do have risks. There are some significant risk factors from taking thyroid medication. We know that risks of many types of cancer are higher, like about 50% higher, and for about a dozen different kinds of cancer. We also know that total mortality risks are higher, like almost doubled. So it's a big deal. You don't want to do things that you don't need to. So let me talk through this whole 6-step process now and help you make sense out of this. The first step is knowing if you're on thyroid meds, if you're even a candidate to come off, if it's possible to consider coming off of them. Now, this might go without saying, but if you don't have a thyroid, you need to stay on medication. Your body requires thyroid hormone, and they've got to come from somewhere. So if you got no thyroid left, you need pills to make up for that. The other scenario is that if your thyroid is atrophied, if it's withered down, like shrunken to almost nothing, it's actually not as common, but it does happen. And in those cases, it's also harder to not be on medication. Most do need medication longer term. And then another scenario is if you're pregnant or nursing. So even those that can successfully come off medication, it's a difficult process sometimes, and you can't really embark upon that when you're pregnant, because that by itself also causes a lot of change to your thyroid. So those are things that are absolute contraindications. The other consideration is you need to have a team. You need to have your prescriber on board with the whole idea. They've got to be behind you and believe that it's important and have some ability to guide you in the process. And it's also good to have some expectations. So coming off can mean just that, taken at face value, or it can even mean lowering your dose. Some of those drawbacks about being on treatment, those are things that even if you're doing less, that can still be useful. There can still be benefits to being on a lower amount. So that's the first step, is just knowing if you're a candidate or not. The next step is knowing, how likely are you to be able to reduce your dosage? And there's a few factors we know that make people more or less likely. Now, none of these are absolute. So you could have a lot of these things counting against you, but still be able to reduce, but they're just all probabilistic. The first one is how long you've been on treatment. So how many years have you been on thyroid medication? The more that it is greater than 4, the more likely you'll need to stay on some longer term. So 4 years is a line. The other thought is, have you been overdosed on medication? Are you taking too much? Is your dose higher than it should be? And if that's the case, that also can make it harder to come off. The more you take, and especially when it's too much, the more that can shut down how much your body makes by itself. Now, a big one here is, what was your original diagnosis? So if you're someone to where your thyroid was at that overt stage, you may need treatment longer term. If it was milder, you may not need it as long. Here's a couple of interesting ones. So thyroid antibodies, so anti-thyroid peroxidase, anti-thyroid globulin, they're positive for a lot of people, but they don't really predict whether or not you need medications long term. So they're not a factor. And there's even some data saying that if they are positive or high, they may improve your odds of not needing medication long term. Can you believe that? Another weird one is a family history. If a lot of people in your family have had thyroid disease, that actually raises your odds of not needing treatment long term. A lot of you all are just coming on. This is a 6-step discussion about how could you quit thyroid medication. I'm just talking through the second step, and you can catch the replay afterwards to hear all of this. So the third step is having realistic expectations about the process. What does it feel like? How long does it take? What do you do afterward? Can you have side effects? What do you test along the way? What does that testing look like? So it's good to have some expectations in place to know what to expect. In terms of duration, there's different protocols, and I'll talk through those, but symptoms, they can worsen. It's possible that even if your body will be able to work by itself, that there may be a transition period during which time there's less medicine coming in, but your body hasn't yet picked up the slack. And during that transition, you may not feel your best. And this can happen. There have been big studies done on those who deprescribe, and about a third of them do have some symptoms that are significant. Another third tends to have minor symptoms, and a final third has no symptoms. So part of the expectation too is knowing what your role is in this and what your capacities are. And when someone does deprescribe, it's best to have them be working with their doctor, and also to have them know that they can stop at any point. They can quit lowering, they can go back, they can change however they wish. And of course, let their doctor know and follow up with their doctor, but not to need to delay a change based upon that process. So those are the expectations. You should expect to be in charge, and you should know that some symptoms are possible. For those who can successfully come off, the symptoms are not severe. The fourth step is making sure your body is ready. And what do I mean by that? Well, there's some things you can do to make your odds better. Some of the studies on deprescribing thyroid meds had people lower their iodine intake beforehand. It had them cut out high sources of iodine from food or from supplements, and that's known to help increase the odds. So that's one easy step. The other one is making sure you've got appropriate amounts of micronutrients there. Now, there's a lot of ones out there that can help your thyroid just function normally, that can help it come back online again, that can help your body respond better to thyroid hormones. And I made a line called thyroid-specific formulations. And of those, the ones that are most normally used for those who are lowering their medication include thyroid daily, hypothyroid support, and T2, T3 converter. I've talked about all those in some detail in other videos, but those are the basic ones that make this process easier. And the last part about making sure your body is ready is checking for and managing any comorbidities. There's a lot of conditions that commonly go along with thyroid disease. That can include low levels of iron, abnormal cortisol, fatty liver syndrome. Those are some big ones. But if there's some obvious things that make your body do worse or feel more symptomatic or hurt your thyroid, Yeah, if you can identify and take care of those first, it'll all go easier for you. So yeah, that's the fourth step, is making sure your body is reasonably ready. Fifth step is making a plan with your prescriber. And this is the details about when and how. And in doing that, you want to have an appropriate supply of the medications you'll need, because as you're lowering it, you'll be taking different potencies. And the easiest thing is to have a lot of low potency pills so you can just take fewer pills as you go. So yeah, rather than having 5, 6, 7, 8 different potencies on hand, if you have a lot of low potency pills, you can change the number of those as a more easy step. Another thought is some will change to slower acting thyroid medication. That's primarily those that are T4 based. And those are nice as someone is tapering because they can change how many days per week they take their medicine. So rather than taking different potencies, they can use different frequencies. So having medications planned and ready, that's part of this. Then the next one is building out the schedule and working out what that whole taper schedule looks like. There have been a couple different ones talked about in medical research, and some are faster, some are slower. Some are as quick as 2 weeks. So one set of protocols has someone take a T4 medicine on alternating days for the first week, and then half the dose on alternating days for the second week, and then be done. So some are as quick as that. Most commonly, schedules do a 2-month or a 10-week time frame. And those allow for roughly a 25% dose reduction every other week. And that's a little more gradual. Some will consider even a slower process, like 4 to 6 months, and that's reasonable, but there is a drawback. If you go too slowly, then the thyroid might not get engaged to come back online again. So some of the studies have shown that the 2-month may be more of a sweet spot, and too low could be counterproductive. Now, it's important to know that, again, your symptoms matter and your communication with your doctor matters. So your doctor's got to be on board and informed and supporting you, and you've got to have open communication with them. And it's important to know, too, that once you get going, your thyroid scores aren't always as meaningful, especially your TSH scores. They do elevate as someone does taper, and that's part of the healthy way that the thyroid comes back online again. It doesn't always mean that things are not working. So the sixth step is then to do it, to follow the schedule and stay in communication, work through the taper, watch any key symptoms, and we think then about troubleshooting. So what do you do if you're in the taper and not feeling well and just not functioning? Well, of course, the easiest thing is to reverse, go back up to the prior level at which you felt your best. Another thought is to consider screening your iodine levels. And this is where urinary iodine to creatinine ratio tests can be helpful. You can see if you're at a good target or not. And then also reconsidering those issues about the comorbidities, about the other factors that give rise to this. They can be totally relevant. So that's the basic idea. Once you're off medications, about 3 to 6 months later, your levels do stabilize. And it's good to make sense of things to see where the dust settles. There's a lot of questions about things like low-dose naltrexone, extreme diets, iodine helping. And overall, these things have been studied in various ways, and low-dose naltrexone has been shown to actually raise someone's need for medication, not lower it in the one clinical trial that was done. AIP, 2 studies have been done. Neither one showed that it helped thyroid function. So yeah, not things that always make a big difference. So quick recap, somewhere around 85% of people on thyroid meds aren't getting benefit from them because they didn't need them in the first place. And many can successfully take less, and many can come off. And doing so can be healthier because there's fewer risks longer term. Just seeing someone coming on to an Instagram account. I do, at Dr. Alan Christianson is where that is. But thanks for those who are here, and I'll keep an eye out for follow-up questions on this video. And let me know about topics. My big focus is thyroid disease. This has been something I've treated for just about 30 years. Advanced natural thyroid care is my big thing. I'm a board-certified naturopathic endocrinologist. And if there's ways in which you're struggling with your thyroid, there's often a conventional approach and a pop health approach, And then there's real evidence, there's like good data, and that's something it's not always in between. It might be different from both of those, but I'm happy to give whatever input I can to help, and let me know where you're at. All right, Dr. C with you, and take great care.